welcome into another edition of the JayMac Podcast. So actually I have several questions that I want to answer for you today. The first one is whether or not you can catch the coronavirus more than once. Also, what are our chances of getting a vaccine this year? And an interesting case study about the effectiveness of masks. We'll dive into that. Plus, President Trump makes a pretty startling claim about when he will finally be right about coronavirus. Eventually, he says, eventually he will be right. Before we dive into that, I want to remind you to become a patron of this podcast. Please take a moment and commit to a $1 a month, $5 a month, $10 a month donation. You can do that by clicking on the link in the podcast description or going to our social media. Help me bring fearless honesty to you every single day. Now, I want to start off with this interview with Chris Wallace yesterday on Fox News. And there was a lot of give and take, a lot of back and forth. I am most interested in the coronavirus and how it is being handled by the president and this country. And at one point, Chris Wallace started asking the president, why are you guys going after Dr. Fauci? And the president says, Dr. Fauci has made a lot of mistakes. For example, he said before, don't wear a mask. And of course, we all know that that's before the research said that you should wear a mask. And I'm sure Dr. Fauci has made mistakes along the way. The reason is that this is a brand new illness. There's no possible way that you could know everything about it in advance. So using somebody's incorrect statements against them, probably not the best tactic. But Chris Wallace decided to turn around and use the very same tactic against the president of the United States and remind the president where he had been wrong before.
Dr. Fauci at the beginning said, this will pass, don't worry about it, this will pass. He was wrong. Dr. Fauci said, don't ban China, don't ban China. I did. He then admitted that I was right.
But you made mistakes, too.
I guess everybody makes mistakes.
I was going to say, you said at one point.
It's one person coming in from China, and we have it under control. It's going to be just fine.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done. I think we're going to be very good with the coronavirus. I think that at some point that's going to sort of just disappear, I hope. I'll be right eventually. I will be right eventually. I said it's going to disappear. I'll say it again.
But
it's going to disappear.
Does that discredit
and I'll
you?
be right. I don't think so.
So the president's claim is, hey, I'll be right eventually. It's like that saying, even a broken clock is right twice a day. So that was our president's justification as to why it's okay to be wrong. Because eventually he'll be right. Because eventually the coronavirus will be gone. Well, we hope, but I'll tell you this, a lot of the research that I've seen today suggests that maybe it won't be gone. And so I want to share some of those things with you today. So now, of course, the question comes up about whether or not we will be able to see a vaccine for coronavirus. And I have to tell you, there are differing reports and studies out there that contradict themselves. So I'm going to share both of them with you, just so you have an idea of what we're looking at. Oxford has a study published on Monday, today, that found that their vaccine candidate is safe. It has some mild side effects like fatigue and headaches that were reduced with pain relief medication. The injection also led to a dual immune reaction to the coronavirus. Patients in the trial, involving 1,000 people, produced both neutralizing antibodies and the less frequently discussed T cells. This is a type of white blood cell that helps coordinate the blood's immune system and destroys infected cells. They said we're stimulating both arms of the immune system, so that's very promising. What they don't know is how long that immune system will stay active. And with that, I'll give you another study. which says disturbing new revelations have come out that permanent immunity to the coronavirus may not be possible, and that this has jeopardized vaccine development and reinforced the decision by UCSF and affiliated laboratories to focus exclusively on treatments. So did you hear that? There's some laboratories that are saying, we don't think that we can get immunity because the antibodies don't stay in the system long enough. So we're giving up our quest to come up with a vaccine, and we're just going to focus on treatments. Several recent studies conducted around the world indicate that the human body does not retain the antibodies that build up during infections, meaning there may be no lasting immunity to COVID-19 after people recover. And again, the process to actually create a vaccine is long and complicated in the first place. And again, the question about whether or not you can get it once or twice, we still have to answer.
The pressure is on for drug makers to develop a vaccine and bring it to market quickly. Vaccines are preventative medicines. They help reduce the risk of catching certain illnesses. They do this by imitating infections. They introduce dead or weakened versions of the disease-causing germs known as antigens into the immune system. When the immune system detects these foreign invaders, they create antibodies to attack them. And because our immune system is like a library, it stores information and remembers every germ it's ever defeated. So, if we encounter the real germ in the future, our immune system can quickly trigger the memory cells and produce antibodies to defeat it. Unfortunately, it takes quite a bit of time to develop, license, and release a new vaccine, ranging from several months to over 10 years. Once vaccines are developed in the lab, they must go through 3 phases before they come to market. First, small groups receive the trial vaccine. Then it's given to a larger group of people. And finally, it's tested on hundreds of thousands of people. Some experts say there's a 94% failure rate in developing a new vaccine from the discovery phase to licensing. The Food and Drug Administration will license it only if it's proven to be safe and effective, and if the benefits outweigh the risks. But the vaccine might not be worth the effort. Many viruses mutate, so a vaccine that works one year might be less effective or not work at all the next. Today, there's no working vaccine for HIV, malaria, or tuberculosis. So these diseases continue to kill millions around the world each year. But vaccines have led to the eradication of smallpox, a drastic reduction in polio, and progress towards eliminating tetanus.
So again, at this point, we just simply do not know whether or not there'll be able to be a vaccine and how long that vaccine will last. Now, to the question, can you get coronavirus twice? Experts say there's a good chance.
I'm Cherie Saunders with USA Today. Hopes are dimming that herd immunity can help stamp out the tenacious global pandemic amid growing concerns that people can be reinfected with COVID-19. Experts agree that claims of recurring infections require more study, since we're only months into the health crisis and evidence has been anecdotal. But if it's proved that recovered patients can catch the virus a second time, it would affect their own immunity while also complicating efforts to obtain effective vaccines, the holy grail of current medical research. Recovery from the disease provides antibodies to fight off the infection. The shelf life of those antibodies, however, may be insufficient to protect a patient for very long or promote long-term immunity across populations. Dr. Robert Glatter, an emergency physician at Lenox Hill Hospital in New York City, told USA Today, quote, "The possibility of reinfection is certainly real and one that I am seeing repeatedly on the front lines," unquote. Glatter says he has cared for a number of patients who suffer only mild initial infections, get better, and actually test negative for the virus before experiencing a reoccurrence of symptoms. He says the intensity can be worse the second time, adding, quote, "These patients develop difficulty breathing, leading to hypoxia, aches, chest pain with recurrent and unrelenting fevers and chills," unquote, and they then test positive again. In a King's College study in London, blood tests revealed that while 60% of people presented a potent antibody response while battling the virus, only 17% retained that potency 3 months later. all of which could prove the death knell for the hope of herd immunity through a one-shot vaccine or community spread of the virus.
So as you can see, whether or not we will actually be able to come up with a vaccine that works is still very, very much a question that needs to be answered. I saw another story about COVID-19 that I thought was interesting, and it has to do with how technology might be able to identify hotspots. And this is through our internet use. And it makes sense when you think about it. Google, Twitter, social media, they might be helping researchers predict where there might be a coronavirus hotspot in the near future. Now, this is researchers at Harvard. They've created, yes, another algorithm that uses Twitter posts, Google searches, and new location data to predict an increase where there might be an increase in COVID-19 symptoms with a 14-day notice. So pretty simple. Depends on what people are searching for. If they're searching for feeling exhausted, if they're typing in, oh, my joints are aching, or looking at Tamiflu dosage. If you see a geographical area where you see a lot of that going on, you may be seeing the rise of a COVID-19 hotspot. Another question on the list today comes with the help of President Trump, who wants children to return to school. And he talks about how children, when they get the coronavirus, it doesn't affect them, or they don't get it at all. And one of the things that I've said the whole time is, well, what about whether or not they can spread the coronavirus? And can they actually get it or not? This is according to Dr. Laura, I'm going to destroy her last name, Shakurdamian, Chief of Critical Care at Texas Children's Hospital. Sorry, Laura. She says surveillance screening, which has tested all children admitted to the hospital, has revealed a higher percentage of them carrying the virus and not showing any symptoms. The trend is consistent with data from Florida. About 1/3 of children tested in the state for COVID-19 returned positive results, which is higher than the overall statewide positivity rate of 11%. So children actually catching it at a higher rate. Now, the question is, can they take that virus home, even if it's not affecting them, and even if they don't have any symptoms whatsoever? Will they take that home to mom and dad, to grandma and grandpa, to their babysitter, to McDonald's, to whatever place that they're going to? Will they be spreaders of the disease? This is an important question that needs to be answered. And what about teachers and people like my wife who work in a school? What about them being surrounded by all these children who have the ability to carry it? They don't have any symptoms. Can they spread it, and to what degree? This really has to be answered, in my opinion, before kids go rushing back to school, don't you think? And then I will end this podcast with an interesting study. This is actually a study of one hair salon. Just one little tiny hair salon where it was learned that 2 of the hairstylists had COVID-19 while cutting people's hair. And in fact, over the course of 2 days, 139 clients entered this facility. And what happened?
A mask policy at a Missouri salon likely helped prevent a pair of stylists who contracted the novel coronavirus from spreading it to any of the nearly 140 clients they came in contact with, according to a new report for the Centers for Disease Control and Prevention. The agency on Tuesday touted the findings as evidence for why policies recommending face coverings can be so important to slow the spread of the coronavirus, which has infected more than 3 million people in the U.S. and accounted for about 130,000 deaths. Authors of the study study note that some factors prevented them from drawing definitive conclusions, but they say that their findings, quote, support the role of source control in preventing transmission and asserted that they can inform public health policy.
So both of these hairstylists developed symptoms. They were giving haircuts and providing services to individuals. One of them just wore a mask. The other wore a mask and a face shield. And out of all 138 clients who came in and left the salon, not one of them tested positive for COVID-19. I know it's just one little old salon, but I would suggest to you once again that all of the evidence suggests that wearing a mask is a key to keeping the coronavirus from spreading. I had a conversation with somebody on Twitter yesterday, and he said he was talking to this individual who had a theory, had a gut feeling that actually what's causing the spread of coronavirus is people wearing masks. And I'm just sitting there going, what? Wait a minute. How on earth can wearing a mask spread coronavirus? Now, I understand if you believe that it doesn't help, like it doesn't stop the spread, but to believe that wearing a mask actually makes the spread of coronavirus work? Really? How does that make any sense?